Hi everyone, welcome to a 5-minute video study for the NCE. Today we are going to be covering counseling skills and interventions, and we are under letter D, implement individual counseling in relation to a plan of treatment, or you can also say treatment plan. So let's first talk about what is a treatment plan. So again, a treatment plan refers to a specific goal you have for therapy and interventions. And this goal is then discussed with a clinician who is there to facilitate the implementation of these goals. So normally with the treatment plan that is created early on in the therapeutic process, normally it can be started during the intake, and then as the therapy progresses, then some of those treatment planning can kind of really be solidified. And it serves really to drive a session so that the client not just feels heard, and they feel like that they're working on things that they want to be working, but also it's a tool to guide both the clinician as well as the client. So again, think about it as a roadmap. We want to get to this destination, so we're using this roadmap to help guide us to where we want to be headed. Of course, in normal life, there could be construction um, areas, there could be detours, there could be traffic jams. So with this treatment plan, understanding that there's going to be these issues that come up, then you want to understand that this treatment plan will be modified as time goes on. And even let's say that the client does really well, they meet their initial goals, but then they're wanting to work on other goals that are even that could be more complex or more multifaceted. So let's say they reach their destination, but now they're wanting to go to a more difficult or a more complex destination. So that's where that treatment plan comes in. So that's that shift, and that not even necessarily a modification, but as you're looking at the layers, well, then you're adding to it as the therapy continues. So those are just some things to keep in mind. And then when you're implementing this, or when you're implementing a treatment plan, you also have to understand that even if the client may want to work, let's say they want to work on social skills, but then you're noticing other things that impede those social skills. Again, you're the clinical expert. Well, then part of your part of that relationship, part of that job duty is to educate that person. Yes, we definitely want to work on these social skills, but there are other things that are getting in the way of your ultimate goal, and we want to address some of these issues so that it builds upon ultimately what your main goal is. So part of therapy is to educate the client on some of the complexity, some of the layers, some of the history, which the client may not even realize, because they're just kind of looking at the destination, but they're not seeing everything that it takes to get to that destination. And that's part of that psychoeducational piece within that treatment plan, is having that clinician provide that expertise for the client so that the client can then see for themselves, yes, I want to ultimately get here, but in order to get here, I have to build upon these skills first that then will allow me to to see or to kind of ultimately get to the point where I want to be.